Hello, everyone. I am Emily with Fort Worth Moms, and I am very excited about having a one-on-one chat this morning with a local physician, Dr. Janelle Dorsett. She is a new partner with Fertility Specialists of Texas. And as many of you may also know, this week is National Infertility Awareness Week. And so this is the perfect time for us to jump on this Q&A with Dr. Dorsett. She is going to tell a little bit about herself, and we're going to go through some questions. But I will state that if you want to ask a question, you can in the comments. Also, you can go to streamyard.com/Facebook if you want to have your name appear. If not, it just shows up as a guest from Facebook who asked a question. So that is a little bit of housekeeping. Before we get going, I'm going to switch over to comments so I can see them when they pop up. Dr. Dorsett, will you please tell us a little bit about yourself, how long you've been in Fort Worth, what your specialties are? Just help us get to know you.
All right. I practice the subspecialty of reproductive endocrinology and infertility. It's one of the subspecialties of obstetrics and gynecology. I have practiced this field since 1985. I previously was located in Lubbock, Texas, but moved to the Metroplex in October 2020. I grew up in Arlington. I have 3 daughters. I'm married, but I wanted to move back to the Metroplex to be closer to family, especially my mother, who's 90 years old. And it's been a real good experience. I've enjoyed joining Fertility Specialists since October.
Super. Fertility is obviously an important topic to Fort Worth moms. We even have our own, we have kind of a private Facebook group called Fertility Discussion with Tarrant County Moms. We have walked alongside women who have struggled with fertility issues from the get-go, and a lot of moms who have struggled with secondary infertility. So this is something very near and dear to our heart, not only for our readership, but for women on our team have walked down this pathway. So I will, once we finish up our Q&A here, I will add links not only to Fertility Specialists of Texas, but we will also add a link to our own Facebook group, our fertility discussion group. So you can look for those once we're finished here. Okay, I have a lot of questions for you. Are you ready?
Yes.
Okay. The first question I'm asking, and I'm asking it because it really is the number one question we field about this topic, is how do you know it's time to seek medical support for your reproductive health, particularly for that mom who is trying to conceive for the first time?
If a patient knows that they have a problem, say their cycles are very irregular, then probably they should seek care from someone like myself immediately, because there is a problem and doesn't seem logical to wait the usual 1 year or whatever before trying to find out what the problem is. It creates a lot of frustration. But in general, the guidelines are that if a person has used no birth control with their partner for 1 year, if they're less than 35 years old and they haven't conceived, then they probably should consult someone like myself to find out, what are the problems and what can we do about it. If you're a little older, 35 and above, the general guideline is if you've tried or not used birth control and had normal sexual activity for 6 months and have not conceived, then probably you should check in with someone like myself.
Okay, great. What kind of options are there? And building off of that, what are the actual services you provide for your patients? Like, what are our options?
Well, at our clinic, we offer the full gamut of services. This would be from trying to help someone ovulate with using like letrozole or Clomid, to doing artificial insemination if the husband has a lowish sperm count. In vitro fertilization is obviously one big area that we use.
Mhm.
It's the most effective treatment modality that we have, although not everyone needs that. Um, we have a donor egg program for women who have gone past the normal reproductive lifespan and are still wanting to have a baby, and they can use eggs from someone else. We do gestational surrogacy for a woman who perhaps has had a hysterectomy, but she still has her ovaries. Another person can act as a carrier for her and her husband. We offer donor sperm services for single women who would like to have a child, or female couples who would like to raise a family also.
Okay, a lot of options.
Yeah.
Um, Fertility support applies to couples who are having like difficulty conceiving, but it also applies to people who wish to build their families in other ways, which you kind of alluded to. Um, so can you tell us just a little bit more, like for those who might be interested in using kind of what you talked about, an egg donor, surrogate services, even like single parents, same-sex couples? Um, like, can you give us a little bit more information about that? Because I think those may be the areas of fertility support that people are less familiar with.
Yes. We do quite a bit of intrauterine insemination, either with the partner's sperm
Mhm.
or using donor sperm from a commercial sperm bank. The specimen is sent to our clinic, and when the patient is ovulating, then the donor sperm is used to artificially inseminate the patient. Um, this is helpful in female couples who want to have a child. Um, Also, single women, women who are older and have not found the partner of their life, but do want to start their family before their option of fertility is
Right.
closed for them. Um, we offer the possibility for male couples to use a gestational carrier to uh, achieve a pregnancy. Donor eggs would also have to be used in that circumstance, of course. Um, but we help, these type couples, but normal couples as well, as far as as far as heterosexual couples. We are inclusive. Inclusive of everyone. We have patients who are older, patients who have failed at other clinics, or people who are new to the whole process and don't really know much about how their body works, and
Right.
they just need someone to help them figure out what's going on here and why can't I get pregnant.
Yes. Um, in another article that y'all had posted on our Fort Worth Mom Site, you talked about something that was kind of interesting and new to me, and that was how testosterone therapy is a growing cause of male factor infertility. And I will kind of plug in there like fertility issues don't only affect women, they also like affect men too. So can you speak a little bit more about that?
Um, as men age, often their testosterone levels drop. They feel very fatigued. They don't have as much of a sexual drive as they used to. They just feel like something is wrong. Oftentimes, they'll go to their primary care physician, and a testosterone level will be drawn, and they'll be found to have a low level. and started on testosterone therapy. It does make them feel better to have a normal range testosterone level, but unfortunately, it also decreases sperm production. So I've had many couples come in and don't know why they're not getting pregnant. I find that the husband is on testosterone therapy and there are no sperm at all. It's complete lack of sperm.
Wow.
We have the gentleman discontinued the testosterone therapy, and within 3 months or so, oftentimes the sperm count has bounced back. That's also a concern in men who use testosterone for weight building, weightlifting, and so they need to be aware that they could be altering their fertility for the future by doing this sort of therapy.
Yeah, that is definitely interesting and something that I did not know.
Mhm.
Um, so as you mentioned in your introduction, you have been helping families with fertility issues for, is it more than 30 years, correct?
Yes,
Yeah.
uh, I completed my. I started my infertility, reproductive endocrinology and infertility fellowship in 1985, and have continued since that time.
Yes. So what would you say, like from all of the years of kind of how this type of medicine has evolved, all of your experience, things that you've learned, what would you encourage women and men to look for when they are just trying to decide what fertility clinic they need to go to? What needs to be the important factors there?
Uh, I think that they should go to an infertility specialist who is double board certified. What I mean by that is
Mhm.
someone who has done the obstetrics and gynecology residency and become board certified, and then has done the subspecialty training, which is an additional 3 years now in reproductive endocrinology and infertility. Um, During the fellowship, we learn how to specifically look for the different problems that can occur in infertile patients and how to treat them best. And so the therapy or the treatment that you'll receive from someone like this is generally uh, more complete, and they'll hopefully get to their goal of being able to start their family sooner versus later. You
Mhm.
want someone who's experienced. Uh, you want to look at their website and see if they offer all the services that you're interested in possibly using. You may not know what those are, but you want to make sure that they treat people for ovulation induction, which means making them ovulate when they don't. Um, Oftentimes, these patients have what we call polycystic ovary syndrome. They're having very irregular cycles. Um, you want to you want to know that they offer artificial insemination or intrauterine insemination services in case that's necessary, and then some of the other services such as in vitro fertilization, um, which is the gold standard treatment when all else has failed, especially.
Mhm.
Um, so experience, a person can go onto a website called SART.org, and
Right.
look at the success of each of the clinics
Interesting.
in terms of in vitro fertilization success. And Fertility Specialists of Texas is on that website. Um, it's hard to really compare clinic to clinic because oftentimes the populations are different. But you can at least make sure that the clinic that you're going to is doing as well as the national average, if not better,
Yeah.
in terms of their success, um, that sort of thing.
Yeah. Um, that made me think of something you said at the beginning, that like if something isn't trucking along, isn't right with your cycle, you're talking about PCOS and other things. Um, we had an OB-GYN one time, I think she was a guest on our podcast, and she said something to me that stuck with me, is no one will ever care about your health more than you do. And I love kind of how you are actually emphasizing that as well. Um, like, just don't wait, even if you are not exactly ready to conceive or have a baby in 2021, if you have things that are off with your cycle or off with your reproductive systems, like, that's an okay time to go see you too, right? So you can, like, figure
Yes.
out what's wrong and try to get yourself on a more normal, like a healthier, hormone balance, having regular menses, dealing with maybe issues of pain that you have, because all of those things that sometimes I think we as women just push through and slough off can be signs of PCOS, endometriosis, or other things. So I really appreciate that you kind of started that off. There are guidelines. Oh, you wait a year, you wait 6 months. But, I want to encourage women out there to know that you are the only ones that is going to care about your health. And you are your advocate. And if something is going off, even if it's not impacting your day-to-day life very much, don't put it off, right? Go see Dr. Dorsett and get on a path to fertility health, hopefully in the future.
I agree with that very much,
That is my
especially,
soapbox.
yeah, especially women who are irregular. There are some consequences of not having periods for years at a time. Some
Yeah,
of the women who have this problem have a period every other year. And even though they might enjoy not having their period, it's not healthy. You
yeah,
need to shed the lining of your uterus on a monthly basis, and you need to seek the care of someone such as your OB-GYN or someone like myself to kind of get you back to a normal place as far as cycling or having a period every month. And so that if you want to start your family in the future, you'll be ready. And at least you'll know the problems that you have and what might be necessary to treat them.
yeah. And those changes occur sometimes after you've had your first baby, but you don't always just need to chalk that up to like postpartum issues. And I know our lives become pretty intense during those infant and toddler years. But yeah, I just want to encourage. If things are off and it's not your typical or what it should be, seek some support in that and some answers for that too.
That's right. I agree with that.
Yes. Amen. All right. If someone is watching right now, and she is, I know that she is, and she has been pondering fertility treatments in her heart and maybe knowing that something isn't right, she may feel nervous, she may feel scared, she may even feel ashamed or guilty. What would you say to her?
That it doesn't hurt to find out what's going on. You don't have to obligate yourself to any sort of treatment, but you do need to be, as you stated, you need to be in charge of your own health. And you need to know that there are people like myself that want to help you. And we will look at your health and assess what's going on and make recommendations. But it's a team effort. And if you want to try something that's not as aggressive as I might suggest, that's all right. We're going to work on this together and then help you achieve whatever goal you have, whether it's to get pregnant at this time or just to be normal so that you can in the future.
Yeah, excellent. Great. Um, I want to say thank you to you personally for taking time out of your morning to chat with us. And Thank you to Fertility Specialists of Texas, in general, for coming along and being a partner with Fort Worth moms and supporting us in the work we're trying to do, to be an encouragement and resource for moms in Tarrant County. That's like a partnership that we deeply appreciate, and you sharing your expertise is so beneficial to so many. I also wanted to hear a little bit more. I think you have some special things going on in honor of Infertility Awareness Week, some very specific ways you are supporting Tarrant County moms right now.
Yes, in honor or in support of National Infertility Awareness Week, we are offering a free fertility check. And all of those who take us up on that can be entered for a free consultation with one of the 6 physicians that are part of Fertility Specialists of Texas, your choice. So if you're interested, please go to the fertilitytexas.com website and see what it's all about.
Great. And for that woman who is watching and she's on the fence about it and she's been thinking about it, this week would be the perfect time to go ahead and make an action on that because there are complimentary fertility checks. So absolutely, if you've been waiting for your sign, here it is. We've got it. Okay, well, I'm going to check again to see if there are any comments. I think we may be good. We will, like I said, update in our description and comments with links to fertilitytexas.com, also to our fertility discussion group, and a few other things, extra resources that we have. We have some articles that were written that we will post as well. So thank you, thank you, thank you again. It was a pleasure to chat with you. Thanks for answering all my questions.
All right. I enjoyed it very much.
Yes,
Thank
and
you.
I hope you have a great rest of your day. Bye,
Thank you.
everyone.
Bye.